Right. Bring people in. Hey, everyone. Welcome. Feel free to introduce yourself in the chat window as everyone files in here. Just going to disable the waiting room so everyone can get in. Hey, Jasmine, it's not letting me disable the waiting room. So if you could keep an eye on that and admit people as they are joining us over the next few minutes, that'd be helpful. Thank you. Right. All right, let's go ahead and get started. We've got a pretty packed agenda for the day. Welcome everyone to the workshop on incorporating health in the residential energy efficiency program design. Feel free to introduce yourselves in the chat, let us know what state you're in and what kind of organization you're working with, and maybe a little bit about any programs that you're involved in. So I'm Christine Garbodi. I'm a senior research analyst on ACEEE's Health and Environment team. And on the line as well today is Sarah Hayes, who directs that program.
Hello.
And you may also hear from Jasmine Ma, who's our newest research analyst.
Hello.
So this workshop flows from work that our program has been doing over the past several years to understand opportunities to leverage connections between health, energy efficiency, and the built environment of the home. And more recently, our work to translate some of that research into a useful format, hopefully for program administrators, to help put some of that information into action in their own local context. So with that, dive on in. So for those of, I'm sure by now everybody's heard this spiel a couple of times over the course of the conference. So I'll just say, let me just jump straight to the big picture overview of how we're going to be using our time this afternoon. So we're going to split things up into 3 sections. Each of them is going to focus on a different aspect of designing residential programs in the context of incorporating health. In each section, we're going to have a short presentation, and then we'll have a mix of quick solo exercises and a group breakout discussion. So any of you who joined us previously will have a chance to connect to some new people. These sessions, we're hoping they'll help you identify next steps to take to move forward on incorporating health into your own programs and to connect with other people who are facing some of the same challenges, hopefully to learn from one another and brainstorm locally relevant solutions. So we will be dividing up by geography. So anyone today who's participating who isn't involved in running an energy efficiency program, we just recommend that you join the breakout conversation for the region that you work in and help enrich those conversations. And for those of you who are joining us from outside the US, welcome. So we had a number of folks from Canada. We'll have options for you all in terms of what breakout room to join, either a room specific to you, or if you'd rather join the nearest US region, that'll be up to you. So. And if you have questions as you go, as we go through any of this today, please feel free to type them into the chat box. We'll be monitoring that and we'll respond to them as we're able, or else at the end of the session. And we can definitely follow up with any we don't get to. We'll also be dropping a lot of links and instructions in there. So we just recommend having that box open throughout today. So one thing to note, we are going to be using some online documents to help make this more interactive today. We have a workbook document that takes the shape of a Google form that'll have a bunch of questions in it that will be part of the exercises and breakout prompts for today. A link to that should be dropped into the chat shortly for you. So I would say, please go ahead and open it now just to make sure you can. If you have any issues with this or with anything else today, go ahead and send a chat to the organizers in the Zoom window, and we'll help get you connected to whatever you need. So we're going to ask you to use these to help these are meant to sort of guide some structured thinking about the different topics that we'll be covering today. You can also return to these documents later. There's a lot of dense content in there, and we don't expect you to have time to really think through every answer to everything in there. So these are hopefully going to be really valuable to return to later. So please do go ahead and press submit at the end of today's work session to save it. It'll email you your own responses and let you access them later to edit or continue working. And we'll also be able to see any feedback that you send us that way. So, right. So with that, I will hand it over to Sarah and we'll get started.
Thank you, Christine. And I'll just repeat, because I have been reading the folks introducing themselves in the chat, and I think that's super valuable. And given that we have built in these different networking and discussion parts of the experience here, I hope that the rest of you use that space. So that would be to open the chat and put in your name and where you're from, and maybe a little something about your interest in this space. So we're covering several topics today. As Christine said, the material is pretty dense. So we've condensed it, and you'll be able to access resources that go into greater detail after the session. The first topic we're going to start with is to set the picture for why you might consider offering health services in conjunction with an energy efficiency program. What does that look like in practice, and how you might start thinking about what services would be beneficial for you to offer depending on your customers' needs and your goals and limitations. The information that we discuss in this section is structured around one of those external resources that we talked about. It's a guidance document, and we will send you the links to all of that. It's in the Socio platform Dropbox. Christine, does everyone already know how to use that?
So the workshop page in Socio for this session, there's a link in there now to a PDF full of useful links, including everything that we're going to be dropping into the chat today. And that'll be available after the session as well for you to continue to return to and access. So
thank you. I think I'm handing it back to you now.
Yeah, right. So let's kind of take a step back and talk about how we're defining health today. And think in a lot of different levels about connections between energy efficiency programs and health. And these impacts stem from changes made in the home environment where services are being provided, but they also encompass a much wider set of social and economic factors that can impact health and well-being at the level of participating neighborhoods and communities as well. So when we talk about the potential for energy efficiency to impact health, we're talking about a pretty broad range of opportunities and a lot of different types of potential benefits. So when we start at a foundational level, when we change buildings, we impact the health of the people in those buildings. So anybody running an energy program that modifies homes is already influencing the health of their participants. We can start to think about the potential health impacts of weatherization in particular in terms of the health stresses that are lessened or removed by the kinds of modifications that you're making during weatherization. So when we seal buildings from the elements, stabilize indoor temperatures and humidity, and filter and ventilate indoor air appropriately, then there's a whole range of potential effects to indoor air quality and other factors that might trigger health symptoms for people in those spaces. So we might expect to see improvements for participants in terms of respiratory illnesses like asthma, COPD, allergies, and so on. We might also expect reductions in some physical symptoms that might be less easy to document or to quantify, things like stress levels or sleep quality and the sorts of the issues that can stem from both of those. And furthermore, those reductions in physical health stresses and symptoms can have knock-on effects that lead to a broader range of impacts to participant welfare and well-being. So whether that's reducing a household's energy burden, freeing them from having to make choices between energy use and other necessities, like adequate high quality food and medications, whether we're talking about reducing medical bills or time lost for caretaking, reducing lost days of work or school that might stem from illness, or just generally improving comfort and safety in the home and a sense of well-being. These are factors that have a very real impact on people's lives. And so in line with this framework, obviously economic factors do play a role in shaping health as well. And one metric that we look at to connect energy use, health, and broader issues of equity is a household energy burden, which is the percentage of annual household income spent on annual energy bills. So because spending on energy, including to ensure adequate heating and cooling, Because this plays a direct role in health and safety and comfort, families with limited financial resources and high energy burdens are sometimes forced to make decisions between paying for adequate energy use and paying for other essentials like food and medication, like I mentioned. And so these choices between necessities are sometimes referred to as heat or eat dilemmas. So energy burden as a metric helps to kind of visualize energy affordability and identify which groups are shouldering disproportionately high burdens in that area relative to others. And that in turn can help us think about which communities can benefit most from targeted energy affordability and energy justice related policies and investments, as well as groups that might benefit disproportionately from a stronger focus on health in some of these in-home programs. So this slide comes from some of our ACEEE's energy burden work. The recent report came out in 2020 that updated some previous work in this space. Our local policy team found that the median energy burden for Black households is 43% higher than that of white households. For Hispanic households is 20% higher than that of white households, and median burden for Native American households is 45% higher. It's really, I guess, just in line with lots of ongoing conversations and over the past 2 years in particular, helps to, I guess, keep in mind that different groups are facing very different, shouldering different levels of burden from one another in this area. Just going quickly. I'm going to pass it back to Sarah to talk more specifically about offering health services to meet some of these needs.
Thank you. So as Christine just discussed, the connection between health and energy efficiency work is already there. A lot of the things you're doing already impact health. Adding new services and taking new approaches that leverage those potential linkages can be kind of complex. And so what is the value of making this investment and undertaking this effort? Well, for the rest of the session, whether or not you're directly involved in running a program or not, we're going to ask you to put your program design hat on and think through and understand some of the needs and challenges faced by people trying to move forward in this area. So we're hoping this helps generate conversation and collaboration around identifying what those needs are and how the broader community of advocates, researchers, and built environment professionals can help support work at this intersection. So why should your program offer health services? There's a whole bunch of reasons that might align with the goals that you or mission that you have. Many of these, actually probably all of these, came from work we have done with program administrators to who've either undertaken this already or who are trying to navigate this. And so this is not a list that we generated. It comes from folks like you who are running programs. One of the first is to increase program funding. So the amount of money invested in energy efficiency residential programs is a drop in the bucket compared to what we spend on healthcare services nationally, like an exponential difference many times over. So we're not suggesting that all healthcare funding is going to be diverted to home retrofits, but there has certainly been a movement in the healthcare sector post Affordable Care Act to consider the social determinants of health or the living conditions that people exist in. So we think increasingly there's going to be opportunities to consider health sector funding in the context of improving home conditions. You could also, by offering health services, reduce the number of households that are turned away from a program or deferred. So pre-existing health and safety issues can lead to deferrals of program services. If any of you have experience with that, we'd be super interested to hear a little bit in the chat about what are common health and safety causes for deferral in your programs that you're providing. As Christine talked about already, another possible benefit of adding health services is that you can achieve more equitable outcomes. So high energy burdens are disproportionately borne by some groups more than others. And by providing energy efficiency, you can start to address those inequities. We also have done some research that shows that homes with inadequate housing conditions are not spread evenly by race and socioeconomic status across the country. So this is another area where addressing pre-existing conditions and causes of deferrals can help address inequitable housing conditions. The next slide, you can expand your program reach. So there have been some studies done that talk about why people opt into energy efficiency programs, and health, comfort, and safety are really high on the list of motivators. And then you can better serve the public, maximizing benefits that accrue to customers, reducing the risk of harm. Those are public goods, and they benefit customers individually. So another question for the chat. I don't know if anybody put in any causes of deferral. I don't think I saw any. Here's another chance to chat. What would motivate you to add health services to your program? Please drop it into the chat if you have an answer to that question. And while you're doing that, I'm going to hand it back to Christine.
So let's talk more specifically about what kinds of health services we might be appropriate to offer in conjunction with energy efficiency services. So we talked earlier about the kinds of health impacts that weatherization can have. So one entry point to starting to think about what services might complement weatherization is to look at what some of the overlaps are between weatherization and traditional energy efficiency measures, and what other kinds of services that are meant to prevent or mitigate specific types of health risks in the home. So we used a Venn diagram here. You can kind of see there's some natural overlaps between the kinds of things that you might provide as part of energy efficiency interventions and what you might want to provide to address other types of health threats. So for example, so the green circle in the middle is capturing energy efficiency and related measures. The blue circle on the left contains measures that might be part of an asthma mitigation effort, for example. So that might include additional services like in-home education for patients and families, and more targeted asthma trigger removal. So there's a lot of potential to provide health-related services in a home by preventatively target a health issue like asthma, and the measures that are involved in that are complemented meaningfully by what weatherization is already doing to the home environment. As another example, the red circle on the right contains measures that might be part of a trip and fall prevention program, or something to help older people age safely in place. The yellow circle at the bottom highlights some of the things that might be part of preventing hypothermia or heat stroke in the home. These aren't comprehensive, obviously, but they give you kind of a flavor of the kinds of alignments that might be possible, depending on the kinds of services that the communities you work with could benefit most from. It's worth noting here, if you know what kinds of health issues are most impacting the communities your program wants to serve, you may be able to tailor a list of services that meet those needs that also complements the work you're already doing as an energy program. I'll hand it back to Sarah to talk about an example.
Yeah, so we have highlighted an example that I think is super exciting to show you what this might look like. There are many programs across the country that are blending health services with their weatherization or energy efficiency services. The one we're highlighting right now is a NYSERDA program, and it's called the New York State Healthy Homes Value-Based Payment Pilot. And NYSERDA is funding the initial, I think it's about $10 million that they're funding to do weatherization in homes, plus asthma mitigation and injury prevention. And they expect to be, the program is designed and they expect to be 100% reimbursed with state Medicaid funds, which is pretty exciting. And you can see, we're not going to go over all of these, but this is a list, I think a not final list, but a list of the kinds of services that they're going to provide as part of their injury prevention package. So obviously there's a pretty robust list of things that you could consider offering as part of injury prevention. you could have a much shorter list. The next slide here is asthma mitigation services that they are planning to offer. Again, you can read through this. Many of these things are also energy efficiency measures. So thinking back to that Venn diagram, there's overlap between some of the health services that might be offered in the energy saving services.
All right, so clearly there's a lot of options. How do you start thinking as a program about where to start in terms of deciding what direction to go and what kinds of things to offer? So different programs may have different goals based on what their organization, what their needs are as an organization, and what the organizational mandate is. We'll talk more about that in a moment, but in talking with programs over the last few years, some of the goals that we've commonly heard program administrators cite for including health services include, procuring new sources of funding to expand, the number of people that are able to help, increasing participation that way, and also reducing deferrals. As well as increasingly, we're hearing people mention that they're interested in how to serve their participants more comprehensively and more equitably. So during our engagement this spring with that group of several hundred program administrators, we did some straw polling during some of our sessions, and more than half, I believe, cited equity as one of their top concerns for why they were interested in this work, so, which is a pretty exciting shift to see. But as encouraging as that is, to see that become more of an explicit goal for its own sake for many people, it's also worth remembering that some different programs may have particular opportunities or limitations around what kinds of services they can include, or what kinds of partnerships they can form, especially depending on local regulations and requirements for how ratepayer funds can be used, which may be very different from place to place. So a lot of utility programs may be constrained by rules around how ratepayer dollars can be allocated, and the utilities mandated missions. WAP programs, so programs funded by the federal government, may be more guided by their state's approved health and safety plan within, it's part of their application for that grant. Just as a side note there, so there's a pretty diverse list of services that can be offered under DOE guidance for WAP programs, but like I said, each state may have a tailored subset of those depending on their plan that they filed. Not all of those plans are available easily online, but we've found a lot of them as part of our research this year. And so there's a link in here that if you were interested in trying to see what your local WAP agents or community action agencies and WAP subgrantees might be able to do, if you're interested in partnering with them, it might be worth looking to see what the rules are for your state. And you can find a lot of them at that link there. Or else you can reach out to your state WAP agency directly to get that information. It's one more question for people in the chat. What are the barriers that your own program has faced so far in trying to offer health and safety services, and what are they? Just might help give a flavor for people who may be in different circumstances across the country.
Can I just jump in real quick? I haven't seen a lot of activity in the chat boxes, and we're getting ready to send you into group discussion. So while Christine is explaining how that's going to work, could you please turn your cameras on and get ready for that? Because it's going to be a fun discussion.
Oh, all right, so we're going to give you a little bit of homework first, though. By homework, I guess I mean in-class work. So I've just dropped a link to our session workbook into the chat. Go ahead and open that up now, and you'll see in there under a couple of questions about name and email address basics, a section called breakout 1 pre-work questions, or something close enough to that. And so we're actually going to give you a few minutes to look through those prompts in that first section, just the first section, and then try to jot down answers to as many of them as you can. And that will sort of help seed the conversation that you'll have in your breakout rooms in a minute. So I'm going to start the timer on that now, but I am also going to go ahead and talk a little bit more about the breakouts at the same time. 1 minute. So during the breakout sessions, we're going to ask you, you'll be able to sort yourselves into Oh yeah, sorry, it looks like a couple of people aren't able to access that. We'll see if we can find another link during the first breakout session, or find another way for you to access that, those questions. So if you're not able to, yeah, okay.
If they're not able to access it, can they drop their email into the chat and we'll email it to them?
Yeah, it maybe they can't open it, but we can send the questions by email actually. If you go ahead and drop your email in, I'll send them to you in a minute when the breakout session starts. So, so during these conversations, we're going to ask you to designate one kind of discussion leader. There'll be about 8 breakout rooms, and there are not 8 of us over here on the ACEEE side right now. So we will ask you to kind of pick one person to sort of help move things along, and one person to take notes in another shared document that we'll give you a link to in a minute. So I'm going to give you until 3 o'clock to work on those questions in there. So.
And thank you to Stephanie, Patrick. Oh, I think those are the only faces I can see. It's going to be a more engaging discussion if you can all see each other. So I'll just invite you one more time to turn your cameras on in preparation for the group discussion.
Is there a telephone call in number for breakout sessions? If so, when we do go to the breakout rooms, I believe we'll be able to manually move you into the rooms. And I'm not sure how that will interact with anybody who's joining by phone for audio. But it may be the case that what will happen is I'll be able to hopefully just drop you into the room you want to go in. So.
Christine, would you like me to say which breakout room is for which region in the chat?
People 2 more minutes to focus on questions real fast.
Okay.
So right now they're filling out section 1 of the workbook, right?
Yeah. Pull in another version of those questions to email to anybody that's having trouble with them. So. I'll give you about 1 more minute. And if anybody else is having difficulty with the Google Forms for organizational security reasons, go ahead and drop your email in a private message to me, and I will email you the question list. Wonders of modern technology. All right. Let's go
Hey,
ahead.
sorry,
Please.
do we submit the answers to breakout 1, or is it just?
No, not yet. Yeah, we're going to use this form throughout the session today, and then submit it at the end so you can save your work and have access to it later, is what we'd ask. So
Great.
yeah, thank you for asking that. Good question. All right, so let me, I have so many windows open. All right. There we go. Okay. So I'm gonna go ahead and open the breakout rooms now. So these are kind of some odd groupings. They're roughly geographic, sort of based on interconnections and also based on how many people had registered from each of these places as of last Friday. So if there's a room that you feel you belong in that your state is not listed under, I'm going to leave that to you all to make the best judgment call there about where you want to go and who you want to talk to. So this is a guideline. And yeah, once again, another question in the chat. You can save I think you can save the form now if you want to, but you may have to like reopen it through your email if you do that. So I'd recommend not unless you are really worried about losing it for computer reasons. But you should be able to jump back in and edit the questions at that point. So I'm going to go ahead and open the breakout rooms now. If you have any difficulty getting into room, you should be able to choose your own room. But if for some reason you're not able to navigate that, just send us organizers a message in the chat and we'll move you to the room that you'd like to be in. So with that, we will see you back in about 15 minutes. I'll send you a couple of messages in the Zoom room through broadcast to let you all know about times.
So in case you missed it, right now you're clicking on a breakout room by geography to join a group discussion.
I should see the breakout room connection because right now I don't see that.
Okay, it should be a window that pops up, but okay. In that case, go ahead and throw the room you'd like to go in the chat, and I will, Jasmine and I will make sure you get where you're going. Sorry about that. Okay. Now, and if anybody wants to switch rooms, you can come back in and talk to us. So Jasmine, if you want to start at the bottom of the list, and I'll work down and I'll keep going where I am. So. Lots of folks in the Northwest here today. Angela and Jeff, I missed your request.
Angela, Jeff, Wanuola, and I'm sorry if I mispronounced that. Do you all have rooms you want to be in?
I was in the Canada room and I was all by myself. So
Oh,
can you
okay.
randomly find me somewhere?
Okay. Are you in British Columbia or on the other side? I can
I'm in
send you
Quebec.
okay. I'll send you into the Northeast somewhere.
Okay,
Unless
thank
you'd rather
you.
go to the Midwest. Just let's see.
I keep it fun, whatever.
I'm sorry, and that was Angela, or that is
That was Jillian, sorry.
okay. Oh, that we'd sent you. Okay.
She's in room 8 right now.
to-
Yeah, I left room 8 because I was by myself and
Oh, sorry
lonely.
about that.
Okay, now I'm going to 2. Thank you.
Right, and then Angela and Jeff, if you'd like to join a room. Oh, there's okay. Just let us know in the chat and we'll send you where you'd like to go. So. Oh, that's annoying. This previously let people put themselves where they wanted to be. So let me see if there's a setting I can change about that for next time.
There is a third person, Sheriff Quinn, who is not listed on unassigned, but does still seem to be here.
Oh, she she had messaged and asked to be put in a room because she had to step away for a minute. And so I think she'll join it when she gets back. I forgot to ask people to take notes in the breakout document. If anyone will do it for round 2. So.
And still do the report out by chat. So they're there till 3:20, is that right?
Let me double check whether we're behind or not. Yes.
So when they come back, you could just say, after the break, we're going to ask you to put into the chat a main takeaway or something like that. Slide 24 says Christine/Sarah in the notes.
So that's
It's you, right?
yeah, I can take that.
Oh,
You know,
probably noticed funding. That would be me, right?
yeah, that sounds good.
All right, I'll jump in there. Okay, I'm gonna mute and walk away for a second.
I may be able to fix the breakout room situation for the next one. Otherwise, we can just send people back to the one they were in.
Am I seeing this right? That only 4 of the rooms are used and the other, there are 3 that no one's in?
Yeah, that seems to be the case. Which, yeah, I'd base this on the folks that had registered as of last week. So. But smaller groups means better conversations, maybe. So at least people get to speak more.
Yeah, these are good numbers in these groups, I think. A lot of these people are going to know each other already. I think. In the Northwest, I know for sure.
I'm going to step away for just a second. All right, looks like one group is taking notes in the breakout time. So, when we come back from the break, I'll ask people if they did take notes to drop them in there, and that we'll use this for the rest of the session. So. Oh, and Jasmine, just FYI, when you're dropping in links, go ahead and include that whole like text thing, just so that people know what the link is for in case they missed what we said. So
Okay, thanks. I just noticed on the bottom that I had all the links.
Yeah,
that
that's
I
what I
was
was talking
using,
about.
using the ones from the top, so
Okay, gotcha.
thank you.
Yeah, no worries. Let them know we're winding down a minute. Okay, I'm gonna close the rooms, which means they'll shut down in about a minute, but people will start trickling back in before that. So. No. It's like most folks are still in there talking, which is good. So. This is the most windows I've ever had open. Yeah, all welcome back. The last of the room should be closing in a second here, so people will be rejoining. And then I think, yeah, they should all be closed now. Hey, everybody, welcome. So one thing that got dropped in the front end of sending everybody to the breakout rooms is that we did have this document here for taking notes during the session. I've shared that again in the link. So if any of you who were playing scribe for your room took some notes, if you want to drop them in there, that'd be helpful. We're actually going to take a quick break, about 7 minutes. So we'll be back at 3:27. We'll see you back here. Okay, I'll get started again in just a minute. All right. So it looks like several of the groups did find the breakout notes document. There's a spot in there just for the next two breakouts for each group to continue taking notes in there. So it's sort of a matrix of the breakout room number and then the 3 sessions. So yes, we will make sure the slides are available after. They'll be probably available through the Socio platform. I think is how that'll be done. So, okay. So yeah, just glancing quickly through the document at some of what you all have written. Feel free to drop in the chat now any kind of big things that came up for your group, or if you learned something that was interesting to you, or something that was a common theme for your region's room. We'd love to see that, and it might be valuable for people who weren't in your room to know what was going on in it. So as far as so just looked quickly at the document for the groups that had started to fill it out. I saw already somebody had started filling in notes in the funding section, which is sort of what we in line with what we expected. So when we worked with program administrators this spring, funding did immediately come up in session 1, even because obviously all of these different areas we're talking about today are tied together, and funding is sort of at the root of what's possible for a lot of cases. So we are going to focus more directly on funding in our 3rd segment of the workshop, but obviously, like I said, these topics can't really be fully separated from one another. So before we talk about pursuing new sources of funding, we're going to focus on something that can help make the case for that funding, which is measuring and documenting your program's health-related impacts. So go ahead and dive into that. Hand it back to Sarah to introduce that.
Thank you. So as Christine said, we're going to focus for the second part of our 3-part session here on measuring health-related impacts of the programs you're providing. And we did a pretty significant research effort a couple of years back where we surveyed more than 60 programs nationwide, to, all of which were attempting in some way to track or document their health-related outcomes. And I think Jasmine's about to drop in a link to that report. And you are welcome to look there for a lot more information than what we're going to cover today. We have also developed a short guidance document that condenses a lot of the lessons learned from that work and is aimed at program administrators and turning what we learned through research into actionable guidance. So that resource will also be available to you. Going to the next slide here. So we're going to walk through a series of questions that are in the guidance document now, and we're going to just touch on each one very quickly here, and you can find more information in these additional resources. We'll also present some next steps for getting started. But the first question that we'll address is, why would you want to measure the health impacts of your program? And some of these are the same reasons why you might want to offer health services. You can improve program outcomes, potentially attract new funding, but also you could build relationships, demonstrate the efficacy or effectiveness of your program, demonstrate that your program's cost effective, and build a value proposition for these programs. So what we're talking about here is how you could show that you are impacting the health of individuals. And by doing that, you could, for example, build new partnerships with a healthcare provider or an entity that maybe isn't energy focused, is health focused. If you can document that you're having an impact on health, that can be beneficial for those discussions. Similarly with funders that are funding with health outcomes in mind, if you can document that your program is having those beneficial impacts, you could probably have a more effective and productive conversation. So what health impacts can we measure? We're going to focus on those that programs are already documenting and measuring based on that survey that we conducted. And I'm going to hand it over to Christine to talk about some of those. So
I'm going to start with something that a lot of programs may already be collecting data on, but don't really think of as health data. So a lot of programs, just as a matter of course, are already gathering data about the measures that they're installing. So the presence and absence of working, well-maintained technologies can provide some valuable information about possible health or safety risk in a home. Programs may be tracking the presence of adequate ventilation equipment, working smoke detectors, carbon monoxide monitors, or radon monitors, any kind of structural repairs or improvements to home safety that are done as part of remediation of hazards like mold or other contaminants, and the repair or replacement of appliances like especially things like dangerous furnaces. So the history of maintenance and upkeep in a property to key household appliances and systems, whether that's electrical wiring or water heaters and stoves, that can also highlight some of the potential safety hazards and areas for improvement. So documenting and tracking those kinds of activities and those histories in a home is a pretty simple place to start that may require pretty minimal levels of effort from programs, and they may already be doing, in fact. So in terms of, so when we, in the survey that Sarah mentioned, we looked at what other types of measures programs were tracking. Some of the direct measures of health and wellness that we commonly saw were related to things like asthma symptoms and healthcare utilization related to that. Asking directly about things like days of school and work missed, hospital admissions or emergency room visits, or scheduled doctor's visits as well. And the prevalence of other kinds of respiratory illnesses. So of those, asthma symptoms and uncontrolled asthma combined to be the most commonly tracked indicator that we saw in the group that was surveyed, followed by comfort, which that's can be as simple as asking people how they feel about being in their home, but can tell you something like if people are not comfortable in their home, then something's probably wrong. So it's a useful data point. So we'll talk a little bit more about like methods for measuring some of these indicators a little later in the presentation, but in general, these are self-reported measures and collecting them directly from participants by means of a survey or an interview. So metrics related to the frequency of medical care or specific healthcare services might also be during something you could obtain directly from healthcare providers, but this is pretty rare in practice. There's some challenges around that related to data sharing. I've heard tell that it's done occasionally, but we've rarely seen it working yet. So then, so another aspect of another kind of data point you can look for is environmental factors. So a lot of programs are also already measuring some of the physical, chemical, and biological factors in the home that can influence health outcomes. So examples of that might include indoor air quality, temperature and humidity, moisture levels, levels of pollutants like particulate matter or VOCs, radon and carbon monoxide, things like that. Biological allergens and disease triggers, so things like debris and allergens from mold or mildew, insects, and pests. As well as irritants related to participant behavior and lifestyle like tobacco smoke or pet-related allergens. Some of the most commonly measured indicators in this group that we saw carbon dioxide and ventilation rates, followed by the presence of insects and other pests.
So now we're going to walk through some common methods that you might use to measure these kinds of impacts. And to think about how to do this, we have categorized the different approaches into 4 different categories based on what we've observed programs doing. So we're going to talk about surveys or interviews, environmental testing, visual inspections, and modeling as the different methods for tracking and documenting health outcomes. What you do in practice might actually involve a combination of these things. For example, it might make sense to combine environmental testing with a visual inspection of the home. But we'll talk briefly about each one of these categories and give you a flavor of the kinds of health indicators that programs are tracking within these.
So something that, again, many programs are probably already doing is a visual inspection. That might identify the presence or absence of technologies like we talked about, such as smoke detectors or working thermostats. A visual inspection might also be used to identify health risks like pests, moisture and mold, or injury risks like loose carpet or broken stairs or other structural issues, malfunctioning appliances, or other kinds of risks in the home that could threaten health or safety, either for program participants or for people doing energy efficiency work in the home.
Another category is the surveys and interviews. So these are self-reported information about human health and environmental conditions, mostly. They're collected by either a series of questions asked to participants. It could be in writing, it could be verbally. And one of the things I learned as we got into this is when I first approached this work, I thought that we would need kind of a epidemiological study of health impacts, like how many times did you go to the hospital to make a compelling case for health partners? And I don't think that's true. We have learned that a lot of health partners consider self-reported information to be really valuable. And if you think about how people receive healthcare, that's generally what doctors are responding to, isn't it? So if you could get survey information or interview information, that can be really valuable for potential health partners and is often considered a pretty credible method. Another category that we're talking about here is environmental testing. And so one way that you might do that is to go into the home and take measurements about what's happening in the environment. And those measurements indicate the conditions that can influence occupant health. So it could be air quality, presence of pollutants such as particulate matter, exposure to radon, carbon monoxide, other pollutants, volatile organic compounds, VOCs. You can also test the environment for ventilation rates, temperature, humidity, the presence of mold. These measurements can show changes to the home environment that might be attributed to program services. So one thing you could do is, can you take an environmental measurement for presence of humidity or mold before services, and then can you take it again after? We'll talk later about how that's kind of an ideal way to do it, because that points more narrowly at your program being the cause for those improved conditions. And so you can make a better argument if you can do a pre and post look. I'm going to stop there on this slide. Christine, modeling?
And so in the absence of being able to take those kinds of measurements, some programs will sometimes forecast or try to estimate the health impacts of their work based on well-documented relationships between energy use, pollution, health, and other factors. So there's research groups and government agencies, including the EPA, that provide modeling tools and software that can help perform these kinds of calculations and to create credible forecasts or estimates. So for example, a program might track energy use in a home before or after a project, and then these measured energy savings could be input into an EPA model to estimate how much air pollution was avoided, for example, as a result of reduced fossil fuel production demand, or reduced fossil fuel use at regional power plants because of that change in energy use. So this is not a direct measurement of changes in pollution, but modeled based off of things that can be measured more easily. So these kinds of estimates of avoided pollution can be used to estimate resulting public health benefits as well, which can again help build a case, or it can help you start to monetize some of these benefits.
So that covers how you might collect this data. And once you have the data, can you turn it into a dollar value? So you don't always want to report it that way, right? You might say this many people were served that have asthma, and we estimate this many avoided asthma visits. And that's great data to report. Depending on your audience, that might be the most valuable thing that you could report. But very often people want to know, what was the dollar value of the impact, right? How much money was saved by the services performed? So how can you monetize health and other kinds of non-energy benefits? There's lots of ways. Benefits that you could measure include benefits to program participants, so within their home, or to society as a whole. So did your program reduce pollution, and therefore a whole lot of people receive benefits through that reduced ambient, improved ambient air quality? You can also look at the value of an avoided hospital visit, or the value a person places on improved comfort in their home. So those are different things that you can monetize and that have been monetized from programs. You could be looking at a single thing like avoided asthma attacks, or a combination of things like asthma attacks, symptoms, and hospitalizations, or even a combination of health harms, asthma, respiratory illness, sleep quality, and comfort. So there's lots of things you can be thinking about in terms of the benefits that you might be looking at and including.
Jump ahead there, but right. Sorry, my screen is doing something exciting over here. So in terms of how you might use some of these benefits, one aspect of that might be related to improving. You might use some of these, documented changes in. So yeah, improving your program design, monetized benefits may be used to prioritize the services that might achieve the greatest value compared to the cost of providing those services, and can help provide a standardized unit to compare benefits. It might also help you to prioritize equitable outcomes. So low-income households and families of color that are disproportionately burdened by a lot of chronic illnesses, monetizing the benefits of offering interventions to those groups in particular, to help mitigate those kinds of issues, that may help illustrate that investment in these households really is yielding an enormous return and help build the case for those investments. It's maybe helpful when talking to health audiences. So monetized health benefits can be used to justify or prioritize health sector investment in residential programs, which is still a new area for a lot of that sector. This may be important when you're trying to make the case for these investments to health sector funders or trying to establish partnerships with other health actors. And it may also be valuable to utility regulators to see some of these values. So energy efficiency spending by electric and gas utilities is generally subject to cost effectiveness testing. In some jurisdictions, monetized health outcomes can actually be included as a benefit in that process. That can potentially enable increased program funding. So we'll talk a bit more about that now.
So I'm going to go quickly through these slides because we're a little bit over time in the schedule. And I think probably a lot of you are very familiar with utility cost effectiveness testing. We have a whole policy brief on how states are including health and environmental benefits in utility cost effectiveness testing. And I think we're approaching about 20 states that have done so. So that's in the resources section and something to take a look at. But that's one way that the monetized health benefits can be used. And then let's go to the next slide. This is a map from that policy brief where you can get more information about how health benefits are included in utility cost benefit testing. And then I'm going to, Christine's going to take you into breakout 2.
All right, so I'm going to ask you to go back to your workbook document, and I believe Jasmine's going to drop the link to that right now. We're also going to drop in a link to the document for taking notes in the breakout rooms in a few minutes, since we missed handing that off last time. But so go ahead and take a few minutes now in your workbooks, and then right at 4 o'clock, we will send you all to the same breakout rooms that you were in before. If for some reason you would like to go to a different breakout room, feel free to just let one of us know and we'll send you where you need to be. So
4 o'clock in 5 minutes, right?
no, sure. Yeah. And then just to clarify, you should now be looking at the breakout 2 pre-discussion questions in the workbook.
Are we giving them just 1 more minute to finish the workbook and then break out?
Yep. Let's shuffling some things around on the back end of here. So in a moment, we're going to send you back to breakout rooms. We did actually, somebody in the Mid-Atlantic room flagged that that group is very small. And it might be beneficial to merge you all with one of the other groups. It looked like the big active groups are the Pacific Northwest, the Midwest, and let me take another look here. So in a minute, I'll offer you all, if you wanted to go to a different room, we can go ahead and send you where you'd like to be instead. So. Okay. And Steve, I saw you, if you want to shoot me your email address, I can send you a copy of the Google form questions if you're having trouble opening that document. Okay, so.
Okay, thanks.
I'm going to reopen the breakout rooms and I'm going to move breakout room 7. That's better. So and we'll have about 15 minutes and we'll go ahead and designate someone to take notes again, somebody different, hopefully, so nobody gets stuck doing it the whole time. So, all right. Now it looks like you should be able to choose your own room. Is that what's happening? Jasmine, I think, made some changes, so.
Looks like people are moving around. If you're unable to choose your own room, let us know.
So the rooms that are full are 1, 2, and 6 primarily.
Which number is the Midwest room?
Midwest is room 2.
Thank you.
I just want to make sure nobody gets stuck in the room by themselves. So, all right, and we'll take you to 5. So 5 is actually empty. So I'm going to put you instead. Like that. Maybe like that. Okay, moving.
Steve, do you want to be in a room?
Yeah, 7 would be great. Thanks. The mountain in the west. Thanks.
I'll put you there right now.
Well, actually, I think he's the only one there. So,
Oh. Moving him to 6.
thank you. Just let people know that if they got put in a room,
Thank
they
you.
didn't want to be in.
Thank you for Deb's trying to figure out how to talk to him. Thank you.
Angela and Jeff, if either of you are still with us, you're welcome to join a room. Let us know. We can send you where you want to go. So. Yeah, I think the issue is I had set up the 8 breakout rooms as pre-assigned rooms, which meant that then we had to manually assign, where I thought what I was doing was being helpful and making sure they were there when we needed them. But I should have waited and opened them during the session. So I set the number to 8. So it worked out. So.
Jasmine, any feedback for us so far?
I think it's going well. Sorry about the tech
No, that was wonderful.
bugs earlier.
No. It wouldn't be a virtual conference without some digital friction. So. They're catastrophic anyway. So.
I don't think that I mentioned our report on monetization when I did that slide. I'm guessing it's probably in the resources, but when you, on slide 44, when you plug the session on monetization, we also mention the report.
Yeah, we'll do. And I think it's, again, I added it to the handful of reports we do call out explicitly at the end during the resource share out. So, but yeah, it's definitely in the document that people will have access to. So. Oh man, I don't know why I said 4 o'clock. I definitely meant, I think I meant 3:50 or something. Thanks for catching that earlier. I'm gonna step away briefly.
This is, I don't know about you, Sarah. It says Robert's already in room 6.
It says what?
It says Robert's already in room 6, but he's asking to be added again.
There he is. He's in now.
Oh, okay.
So I let everybody know we would close the rooms at 4:05 and then take another 7-minute break. Did we miss any questions in the chat that we should address?
We'll keep asking if they're gonna, where they're gonna find the slides.
Yeah,
Not
I think
keep, I think we've been asked twice.
we'll add them right after the session. Ask Lynn to post them. So I imagine we'll also have a list of who was in here from the Zoom report, so we could email them directly out too. All right, I'm gonna close the rooms. About 10 seconds. So. All right. Hey, everybody, welcome back. Like I think was sent out to all the rooms, we're gonna take a 5 or 7-minute break now. So we'll be back on at about 4:12. So feel free to wrap up any notes you're taking in the shared document, and we'll see you in a bit. Did someone just join from the waiting room?
So, Christine, we ran out of time. We started going through kind of what the states are doing and how they're coordinating with health agencies in Mid-Atlantic. And I think they mainly had questions for, kind of who's been doing that work in other areas. So I took some notes and we did so probably
Yes.
best to just kind of hear a little bit from from Maryland and New Jersey. New Jersey in particular had some pretty interesting efforts to kind of coordinate with health agencies in their states. So.
Okay, that's fantastic.
All right.
Yeah.
Sorry for the. I'm
Oh.
like sort of was going to devote all of my time and attention to this, and I got pulled into a bunch of other things. So apologies
Oh,
for
no,
all
I know
this.
how that goes. So no worries at all.
All right.
Yeah, I
Thanks.
appreciate you being here. And
Okay.
I just sent you the list of questions. I don't know if you received it.
I will. Yeah. Sometimes I did get it. Yeah, I got it. Yeah. Thank you. So,
I know that's
all right.
frustrating not be able to use the Google tools.
No,
but
that's okay.
they did some things that the SharePoint the stuff wouldn't let us do. So
Yeah. I finally was actually able to get into it. So
okay, that's good.
Yeah. Okay. Talk to you about. Thanks.
Thank you. All right, we'll get started in just a moment once everybody files back in. Um, so we did do see there's been some good conversations going on. The three rooms that everybody's in, just so you all know, are the Mid-Atlantic region, the Midwest, and the Pacific Northwest. So everyone sort of found a place in one of those. And Steve Dunn did flag that your all's room was doing kind of an interesting share out of what's happening state by state. We may not be able to, if anyone wants to share a little more about that in the chat, we would definitely welcome that right now. Just for timing reasons, I'm not going to open it up to open discussion right yet, but maybe at the end, if there's time, we could do some of that. Otherwise, we definitely, any notes you want to capture to share with people in that shared Google document would be really helpful, both because we're very curious and also because it would be helpful to let other regions know what's going on that might be similar or different. So we did want to flag also, so as far as we had to sort of rush through the content on monetizing health, but we do have a report that I've dropped a link in the chat from last year on monetizing the health benefits of in-home services that might complement energy efficiency. And we do also have a whole session on this that we recorded as part of our engagement this spring and early summer. And that'll be in the big compilation of resources that'll come out, that will be available for download at the end. So if you're interested in a deep dive into that topic, there's one of those ready to go. So scanning quickly through some of the responses people are adding still. A few people brought up partnerships with health sector actors, and that's definitely a big part of all of this is complementing your own program's abilities and also being able to build relationships with people that know how to talk to funders and others in this space. So I think we'll go ahead and move into our last section now, though.
So our last session is on funding, and we put this at the end on purpose because we think that this is an area of particular interest to almost everybody. And we're going to cover a variety of topics here, and you could probably guess we also have some resources related to finding funding for this kind of work, and we'll share those at the end. But we want to start out by making clear that we're talking about funding and resources. So we could be talking about direct financial support, like grants, contracts, reimbursement for services. We're also talking about things like cross-referral arrangements, data sharing, other kinds of in-kind support like technical assistance, information resources, publicity, meeting space. These things would cost your program money. And while someone might not be directly giving you dollars, they might be giving you other kinds of resources that help free up the money that you have to be spent in other ways. So that's why we're speaking kind of broadly about the kinds of things that you might braid together to free up funding or increase funding available for other activities in your program.
So with that as a kind of a frame for things, there's no one right way to go about trying to braid funding either between programs or from different sources to try to build out work in this area. So every program is going to be a little bit different. Every context is going to be a little different. And there's a huge variety of potential sources of funding, whether it's for services that address specific types of health harms like asthma or lead mitigation, and to support different kinds of common administrative elements that you might be able to share between programs offering complementary services. So it may be possible for partnerships between pre-existing programs to take advantage of some efficiencies that could be created by sharing some of their administrative structures to reduce program costs. So programs that are designed to provide very different types of in-home services are likely to still need all the same basic administrative elements. Anyone who's running a program probably knows what these are, so I'm not going to read through them, but you can think about a program designed to save energy in a house, one designed to help reduce asthma, and one designed to help older residents age safely in place and avoid falls. Any of these programs are going to need some of the same basic elements, and there may be opportunities for a collaborative program to either, for example, combine an assessment of those 3 health risks into a single inspection. So you're sending people for 1 visit rather than 3, and not only are you maybe saving costs on your side, but also reducing the burden on the household receiving services of having to schedule 3 separate visits, for example. And there may be other kinds of synergies that you can find to help make that all work more smoothly and more efficiently. So this is obviously very generalized, but the point is that there's potential alignments between different types of service provision that can create kind of a natural opportunity for partnership. Just quickly, but actually, I'm gonna. So our team did publish a report on this last May. But this is an emerging area of work with lots of different. Anyway, I'm missing a. Well, anyway, there's a lot of different potential sources we could be thinking about. And so not only are new types of grants and opportunities being offered as time goes on, but it's likely that programs like your alls are going to be playing a role in finding new and creative ways to take advantage of some of those opportunities that do already exist. So we, especially in the work we did this spring, we really emphasized the role that peer exchange opportunities play in helping kind of move the ball forward for everyone on this. So I hope that during the last breakout session today, you all will trade contact information and continue some of the conversations that you've been having.
So if you think of the last graphic, that house of kind of the universe of places that you might look for funding, then how do you narrow it down? How do you figure out where you should focus your efforts? So there's some key questions that you might ask yourself when you're looking at a possible funding source. Does the funding meet your needs? What kind of activities can you use to support with that funding? Do they align with your program's needs? So there's a couple ways to come about this. One is you already know what your customers need. I saw somebody earlier mention asbestos and another person mentioned pests. So are you going to go out and look for funding for those activities? Or are you approaching the funding more as we're very flexible and we can add whatever kinds of services the funding might support? That's a really important key place to start. Does your program have the administrative resources to manage the funding? So sometimes funding comes with some reporting requirements. We've seen that with some examples of federal funding that we'll talk about shortly. What about coordination? What kind of relationship management do you have to have with the funding source? So for example, if you're going to partner with a hospital, what kind of coordination do you have to have there? We have seen an example where there was a program hospital partnership and then some people left and the relationship kind of fell apart, and then information sharing became a real challenge in that program. So that's something that is important to consider. And then what are the agencies in your area that might be willing to facilitate? Because when you're talking cross-sector, sometimes there are agencies that can jump in and help foster these kinds of relationships or provide a convening platform. So there's a whole bunch of things you should be considering. Here's a few of them. Go to the guidance document and you can see some more there. And that again is linked at the end. And then I'm going to talk just briefly about a couple of specific federal funding opportunities that are available to most of you. So Medicaid operates in every state. And this is one funding opportunity where the potential funding is huge, but the lift to get there is also pretty significant. It's not an easy thing to unlock Medicaid funding unless your state happens to already be in the right spot, which is that NYSERDA program that we mentioned. There was a lot that went into getting there, but there's a big pot of money now available for these kinds of services. So we have some bullets here. I'm going to go very quickly over what is a pretty technical area, and then invite you to read more about this in our Braiding Funding Report. But within Medicaid, there's several mechanisms you could use to access funding. You could amend the state plan. You could ask for a specific waiver, which is a temporary approach. You can approach the organizations that provide Medicaid service on behalf of the state. So in most places, these are managed care organizations that are contracted to provide services. You could approach them and talk about how to provide services. The second thing here is the Children's Health Insurance Program, or CHIP. And there's about $1 billion a year under the CHIP program that could be used for these programs. This is a nationwide number that is not being used. It's being sent back to the federal government by states. And I'm really excited about this one because we have some funding to support a handful of states that are interested in unlocking that funding. And we'll tell you a little bit more about that later. But that's one where I think the burden is not such a big lift and the money's already there. And I think it's kind of a sweet spot.
So beyond direct healthcare funding, we also identified some types of federal grants that can support activities related to addressing specific health issues or remediating various health risks in housing. So, and that includes some of the Department of Housing and Urban Development grants to address issues related to lead risks and other healthy housing needs. In fact, last year, I believe there was some grants specifically issued in that space to look at how to coordinate those kinds of lead remediation activities with WAP weatherization. So this is definitely an area of interest of how to use those grants to more effectively by coordinating together and looking at what some of the best practices might be. So there may be more funding in that space coming up. We've also looked at, most states have a grant from the CDC under the National Asthma Control Program, which it's a series of grants that are meant to help build infrastructure to address asthma. So for the states that have those grants, there may be opportunities for programs to either negotiate funding for services in some circumstances, but this is also definitely something I'll say from what we've seen, this grant is important, maybe more from a non-monetary support role perspective, and that they're providing potentially technical assistance or other kinds of coordination among different partners in the state that are interested in addressing asthma. So if your state is one of the ones that has that, that may be a good place to connect to start thinking about how to incorporate asthma services in particular. It's also the case that, so a lot of our research on this was conducted either right before or during the early days of the COVID era. And there's a lot that has changed since then, as everyone I'm sure is quite aware. But there's also some pretty major funding proposals that are coming down the pike potentially. Our federal policy team noted a few proposals that may make their way into either the reconciliation bill or infrastructure bills that are under consideration right now that could provide significant funding related to weatherization and specifically to healthy homes and lead remediation work. So sort of a watch this space kind of area. There may be a lot of opportunities that are coming soon. So we've also heard a lot in the last few years about other potential streams of support for homework directly in homework with support directly from the health sector. So with the caveat that this is obviously a time of enormous strain on any organization dealing with public health, we have been seeing some models emerging over the last few years of actors like insurance companies and hospitals moving to support preventive health strategies, including work and programs in homes. So we've also, the one thing to note within that space, the Affordable Care Act created a requirement for a periodic community health needs assessment, which comes along with requirements to plan how to meet those needs and spend some money to do so for hospitals that are nonprofit status. So there's potential to develop some preventive strategies in there that might include work in homes that energy efficiency could either complement or be a part of. And then there's just a huge diversity of other types of funding for this work, but it's very different from region to region. We've seen examples of funding set aside for specific purposes that are relevant here at the city or county or state level, like community development funding. We've seen examples of private company philanthropic grants or nonprofit grants and initiatives. We've also seen people using lawsuit settlement funds. So it's worth highlighting again the importance of partnership here, reaching out to some of the local health and housing resources in your specific area that may be aware of contexts that might fit your program's needs.
So once again, I'm going to refer you to the guidance document because there's quite a bit more detail there about how to get started in this space. And we're highlighting here just a few of them briefly. So building relationships with health-based organizations, we think is a great place to start and one that we saw over and over with programs that have done this. So how to do that, maybe look at what groups exist in your area and what those groups need. And partnerships can be facilitated by finding a regular point of contact or an internal champion who you can go back to and learn from and coordinate with. Those again, I've said this before, but it applies to this section as well. We gathered these recommendations from what programs have successfully done. So we're not here just telling you what we think would work. This is all these recommendations are based on what programs have successfully, methods they've used to successfully gain funding for these purposes. So we talked about measuring health impacts. That's developing a health-based value proposition for your program. We already explained that both health funders and health partners might be persuaded, and they might not understand the connection between the work that you're doing in health. And so developing something that can articulate that can be very valuable. Shared administration of a program, we did also talk about that, and Christine covered it in the Venn diagram. But that's another way to stretch resources to go further. One example of a program that's doing that you may have heard of is the One Touch program model, where there's a single assessment of the home, and then referrals are made to multiple different kinds of services, smoking cessation, food assistance, child services, and weatherization. And then finally, promote equitable outcomes. So certain communities, as we've discussed, bear a heavier burden of risk factors for preventable disease. Often these divisions fall along racial lines, and health actors are increasingly interested in addressing these disparities, but many are not equipped with solutions. In particular, our healthcare system isn't really set up to preventively address people's living conditions, right? They wait till you get sick and then they can help you. That doesn't mean they don't recognize the value of it, right? They absolutely do. So going to them and making this case, look, we provide these services that can address these needs. They're aware of the needs. If you go and say, we have a solution, that is something that we think they might be particularly receptive to right now.
And I guess we're going to talk about the opportunity.
Yeah.
You wanted to
Yeah.
do that information. So.
This is the thing that I said I was so excited about. So we get to work on this with folks over the next year, and we're going to be working with a small cohort of states to unlock these CHIP funds. So there are about 25 states that have unspent CHIP funds that total across those states is about $1 billion. And we're looking for states where that funding is available, where someone has a program that might be interested in trying to access those funds. And then we'll support you in accessing them. So the process is, do you have the funds available? If you do you have qualifying matching funds? And that could be your program. As long as your program is not funded by federal funds, then it's a good possible candidate as matching funds. And then you submit an application, and we'll help you with that. We'll help you figure out who to talk to. We'll help set up the calls if you want that. We'll help you write the application. So if you're interested, click on the link on this. You put it, great. Thank you, Christine. Put it in the chat so you can click on it and fill out a little bit of information, and we'll get back to you.
So we are running a little bit tight on time, so I think we're just going to go straight to the breakouts. But what I'm hoping you all can do is look at the last 3 breakout questions in that workbook, which Jasmine just threw up the link to again, and use those to guide your discussion. So with that, go ahead and send everybody to breakout rooms. Oh, come on. There we go. All right, the rooms should be open, and we'll see you all back in about 15 minutes. And someone just asked if they could stay in the main room and hear if anyone had success stories instead. That is, unfortunately, half the group already left.
But, you know, we do have some success stories in our. I don't know if we made this clear at the beginning, Patrick, but we ran a 6-month program design network program where we had 300 people participate and focused on incorporating health into their programs. And that information is all available to you. So we recorded all of those sessions, and those are live discussions. And there were several really neat presentations from programs that you can access there. And if you're interested in hearing those stories or particular aspects of those stories, let us know what you're interested in, and we can identify the things you might want to go right to.
Cool. That sounds great. Yeah. So what you're speaking to, those, I know you've provided a variety of resource links so far in the chat, and that's not one of those, right? It's something different.
Yeah, and that's actually the thing I was going to do as soon as people come back from the breakout room is I'll just go ahead and give you the spoiler now. Let me pull the link.
Well, I can wait if that's going to be the last announcement. That's fine. Yeah.
But yeah, that's definitely something that's in the downloadable resource file and that we'll share in the link.
Awesome. All right, I'll jump into my room. Thanks, y'all.
Yeah, and we literally had a session on success stories. I think you'll find a lot there.
I think he might be gone already. I'm gonna step back for a second. people are definitely taking some interesting notes in this document, so I'm glad we did that. Definitely some stuff we should follow up on.
It looks like there isn't any other things assigned to me from now to the end. Is there something I should be prepared to say? Or where I could help?
Yeah. If you wanted to scan through the shared document and if there's anything that catches your eye that would be worth flagging as an interesting theme. I think most of what we're going to do is just share through the resources and then talk a little bit about what came up for people during the last breakout or the session overall, kind of open it up to more kind of Q&A stuff. So
This is a cool document.
yeah. We're flagging a lot of really interesting things in it. So there's some leads to follow up on. I recommended people trade email addresses in the rooms if they want to keep conversations going, but they can also connect through the conference platform. So
Okay, I just have one thing.
Sorry.
I have one thing I'll mention from the notes.
I'll also flag submitting the forms. I did leave in those feedback questions. Because it looked like there maybe wasn't I'm realizing as I'm talking that I might have misunderstood an email from Dan, and there may actually be session feedbacks already in the associated platform, but he was talking about presenter feedback not being there for the work sessions like this. So anyway, they're there, and it's people want to get them, they can. So all right, I'm gonna close this. Welcome back, everyone. We do have some additional resources to share with you right here at the end of things. Just waiting until everybody makes their way back into this room. So. About 15 seconds. So. All right. So yeah, thank you all for sticking with us all the way through to the end here. I hope this was a valuable experience for you all to be able to chat with each other about these topics in a regional way. And looks from the notes document like there was a lot of really interesting discussion. So you want to share a couple things quickly? I can get my screen to let me do it. So those guidance documents we kept mentioning, those are available online. We actually just dropped the link. Jasmine just dropped the link into the chat to the page that has these on it. You'll see the top 3 of the topical sections on that web page have each, if you open up the little accordion fold thing, you'll see the guidance document there for download as a PDF. These are about 8 to 10 pages long each, covering the 3 topics that we've focused on today. But there's other materials in there, recordings of some of the sessions we did this spring, covering a broader range of subjects, including a lot of program examples that might be valuable to listen to. So we'll also say we do have all of this is still collected together in that PDF that you can download from the conference platform webpage for this workshop. Some of our reports from the last few years, looking at examples of how work is being done in at the Health and Energy Nexus, looking at sorry, somebody's walking down by my window. Rating funding, measuring and monetizing health impacts, and then some of our other ACEE reports on subjects like energy burden, past work that the health and environment team has done. There's a whole bunch of resources in there, and from us and from others. So we'll check that out. For the last few minutes here, I guess just wanted to kind of open it up and pull out some of the big themes from the session. And if people have questions or things that really came up today for them that they'd like to emphasize, feel free to drop that in the chat, or at this point, you could probably unmute yourself and make a comment if you'd like to. If Sarah had any thoughts on the takeaway document.
I do. I also want to, we had a request to hear from folks who have had success in this area. So if there's anybody online who has a success story to share, now could be a good time to do that. And I want to just call out one of the groups had in their notes, climate change mitigation. And there's a lot happening at the federal level right now where there's going to probably be some new resources available. So that's something to keep an eye on.
A lot of groups were also talking about, looking for opportunities to partner with health agencies, which obviously there's some challenges to that right now, but definitely a good place to start. Anyone have any questions or things they wanted to flag at this point?
Someone did ask the question of how to approach health agencies during COVID. And a couple of pieces of advice. One is absolutely they are overburdened and overwhelmed. So do your very best to be respectful of their time and recognize the situation that they're in. And then also maybe to think about, you can use this time to collect data, develop your value proposition, learn about them. So it's not that there's nothing to do during this time. And then finally, if you read we did a blog about this, but if you read some of the data on who has been affected by COVID, people of color, people of certain socioeconomic groups really heavily hit, some of them. And so that is something that's very present of mind for the healthcare community right now. And you offer services, as we discussed, that can help mitigate those inequities in terms of the living conditions that contribute to those disproportionate disease burdens. So that is something that I think you will find some audiences receptive to in the healthcare sector.
Sure. I was trying to pull up that blog post real quick to share. So. Well, certainly a lot of great stuff being captured in the notes document. Thank you all for participating so well with that. I'm going to be able to pull the blog post up right this second, but we can share that out as well. Oh, it is actually. I just dropped that in the chat if you're interested, kind of laying out some of that bigger picture. So, well, got about 4 minutes left. We can either, if others have questions. Oh, one thing to flag, go ahead and submit your workbook to save it now. And you'll see there's a couple questions there at the end that are sort of feedback on the session. Anything that you all wish we had addressed, we'd love to know about, because that'll help us think about what kinds of work to do in the future that might be valuable. And so likewise, the questions that you all have left in the breakout discussion document are really helpful to see what people who are running and designing programs are curious about, because that can help focus our work. So definitely interested in that kind of feedback, or any other thoughts you had on how the session was conducted, or what kinds of things we covered or might cover in the future. So I think other than.
Can we give them back 2 minutes?
Yeah, I think so. Go ahead and, like I said, remember to save your workbook. Don't forget to get that resource packet off of Socio. And please feel free to reach out with any questions or comments at any time. I look forward to connecting with you again in the future, and great rest of the conference.
Thank you all for your participation.
Yeah, thank you. We really appreciate you all putting so much work into these conversations. So.
Thank you all.
Should be ending. No.